wish you all a very happy World Diabetes Day. In view of World Diabetes Day, October 14, I would like to bring to you a few facts. Now, one of the leading causes of death have become non-communicable diseases, especially lifestyle diseases, and that too especially diabetes and hypertension. For most of the mortalities are morbidities, the silent killer is most of them is hypertension or diabetes. So coming to them, as we all it is due to insulin deficiency or insulin resistance or other some few subtypes. And coming to mainly diabetes, diabetes almost most of the people they come from issues very less. So most of times this diabetes or hypertension they don't have any clinical signs, especially some only 5 to 10% of population will have that polydipsia or weight loss. But majority of patients are asymptomatic. So it is always necessary to screen for diabetes, especially if you have a family history of diabetes, and especially if you are obese, and especially if you have a altered diet or you consume more of your more of fat diet, fat related diet, or whenever your abdominal width is more than 100 centimeters. Okay. Now, when you say a patient is that, especially the fasting index sugars usually are between 70 to 110, and the postprandial blood sugars are between 140 to 180, and random blood sugars are between 110 to 150 or 150. So, a fasting blood sugars of more than 120 hits or any blood sugar more than 200 is considered as diabetes. And how frequently you need to check for that? You can check as much as many times. American Diabetes Association recommends you maintain a personal glucometer for yourself and check as many times as possible if you are a diabetic to cross check whether you are under control or whether you are going out of control. So coming to diabetes, diabetes management is mainly 50% of your diabetes management is pharmacotherapy, whereas other 50% is lifestyle changes and exercise. So lifestyle changes are one of the key things which uh, I need to especially enforce in this short video. Lifestyle changes mainly a everyday workout of at least half an hour. Everyday workout of at least half an hour is must and should, and it should be there for around 5 days in a week, around a minimum of 150 minutes a week. And coming to diet, as you all know, rice are high carbs, so carbs are very high on sugar. So you need to take them only once in a day, preferably in morning or afternoon. And coming to night you try to take minimal food, and most of your food should include vegetables and pulses and other vegetarian diet. And if you are taking deep fried roasted items, processed foods, or any bakery items, kindly avoid those as they contain very high glycemic index and you are more prone to take very high sugars and ultimately leading to diabetes. So lifestyle changes are mainly exercise and diet control. Diet control, avoid those processed and roasted foods and bakery items, and more fat diet and deep fried. And what you have to take is mainly green leafy vegetables such as legumes, capsicum, and bitter gourd. Like those vegetables are very good in controlling diabetes. Even fenugreek seeds are very good in controlling diabetes. And as a precautionary measure, if you are a borderline diabetic or if you are in pre-diabetic phase, you can take the fenugreek seeds in a glass of water every day. Okay. And coming to pharmacotherapy, depends on your sugar level. We grade you accordingly. Okay. Fine. I wish you all a very happy and safe, healthy life. Make sure that especially if you are above 30 and you are having sedentary lifestyle, if you are having obesity, and if you are known to take irregular diet, and if there is any family issue of diabetes, kindly screen yourself and consult your nearest family physician.